Hello everyone, this is Dr. Cui. In this video, I'd like to introduce the preparation of USMLE's step 3, which is also the last exam for the USMLE exams. So for this exam, you first need to get the ECMG certificate in order to register the exam and submit the application form. In the application form, you need to get a notarization. If you are in the US and if you are working in the institution or universities, you can easily get a notarization service from the international student office or from the public safety office. They offer this kind of service for free. If you are not working in the institution, you can definitely go to the local bank, and they also offer this service for free or charge you a little amount of money. If you are outside of the US, there's a so-called online notarization. You can Google it, see how to do that. And after you submit the application form, the whole process for the approval is about 1 month, and then you can schedule the exam. And the exam actually is mixed with step 1 and step 2 CK plus patient management. It's so-called CCS test. And normally for the IMG, we need to spend like 2 to 4 months to prepare for it. It really depends on when did you finish your step 1, step 2 CK. If you finish it within short time and you still have a fresh memory, you need a little time to just need a little time to prepare for it. If you finish the 2 exams for a longer time, then you probably need more time to memorize those old knowledge again. So it really depends. For the study material, I would suggest UWorld as UWorld is must do. It's like Bible, so you probably need to do it at least twice. And also the UWorld notes is also helpful, and to memorize those clinical knowledge, CK knowledges. And also MBOS, you can use it as a backup study material. And also the step 1 for the first aid, step 1, strongly suggest you to go through the microbiology and the pharmacology part, which are also high yield. It's for the microbiology, you need to read it read every details of step first aid. And for the pharmacology part, remember that in each chapter of internal medicine, there's at the end of a chapter, there are a lot of medications. So there, the mechanisms and the how to use it. So just read those part. That's all. Don't read the whole chapter for pharmacology. That's low yield. So just read the drug, the usage of drugs at the end of each chapter of the internal medicine. And also for the pharmacology chapter, you may consider reading about the receptor part, which receptor, which drug work on which receptor. So just focus on that part. And also in my exam, actually, I met a lot of pathology questions. So I would personally suggest you to go through pathoma at least once before taking the real exam. And for the CCS test part, and I suggest using the CCS cheating notes, which is very high yield and it's very short. It's only about 1 to 2 pages. And also 100 rules for step 3 is also useful. And the Crash Step 3 is a good book. But for the CCS test, I would say that nothing is perfect. You need to know their drawbacks and just create your own notes, create your own template. So that's all. So I checked every study material. Always some drawbacks over there. So you should be careful. And for the tools, some people like use the Anki, but I'm not a Anki guy, so I don't like it. So it really depends on yourself. And for the forums, I would strongly suggest using Facebook. So there are a lot of free study materials you can download there, including the material I mentioned, like CCS cheating notes, 100 rules for step 3, and the crash step 3 textbooks. You can download all of them from the Facebook, and also that a lot of people publish their questions on the forum, so people can discuss it, and also they will give you a strategy how to prepare for this exam as well. And the Reddit forum actually is not good. That's only limited information over there. So actually, just a few people on the Reddit, including me, just sell the used study material like UWorld. So I would say Facebook is much better than the Reddit. And for the question banks, you definitely need to do the official question bank questions, and as well as NBMEs. The UWorld is like Bible. As mentioned, you need to repeat it twice. And AMBOS is a good compensatory study material. And definitely you need to use ccscase.com to do those 150 cases before doing taking the real exam on day 2. Because this one can give you a score in each case. And the exam actually, as I mentioned, is a 2 days exam, and schedule this in 15 days between the first day and the second day. So somebody like schedule the day 2 right after day 1, but I would suggest you take a day 2 about 5 to 7 days after day 1, because you need some time to prepare for the CCS test. So that's what I did. I took day 2 after 5 days, after I completed the day 1. So on day 1, they will test you more about step 1 questions plus statistic questions. So it's a little difficult, I would say that. On the day 2, it's it's pretty straightforward. It will test you more about step 3 UWorld questions plus the CCS test. There will be 13 cases in the CCS test. My suggestion is that you need to read every case, every history, patient history very carefully. Sometimes the answer just hiding there, so you just need to take some time to read it, and then you can get the answer very easily. And also for the test of those emergency cases, you must be very well prepared. Sometimes the symptoms is not very apparently, so just be prepared. So the key is to pass the exam. You don't need to get a high score. So mostly the program just would like to see that you can pass the exam. That's fine. And if you don't, for the AMGs, actually they normally just pass the exam after match. For the IMGs, because most of us need to get the H1B visa, so we have to pass a step 3. So in order to get the H1B, you better to complete it before the ERAS open to the program. That's optimal. But if you're not very well prepared, the deadline to pass it in order to get the H1B is by the end of December. Because after December, normally the result will the release of the result will be delayed because of holidays and some reasons. So normally, if you want to get the H1B visa, you have to pass the exam before the end of December. And also uh, you need to prepare you need to prepare very well before taking this real exam. You don't want to feel it or have a look attempt of, on your record during the application, which will hurt you. So that's all of the suggestion I will give to you for the step 3 preparation. So in word, it's easy to pass after step 1, step 2 ski for a short period, but it's more difficult to pass it if you finish the 2 exams for a longer time. So yeah, so that's all. Good luck. Hope you can, or everyone can pass it.